Touching it back on
Absolutely.
the therapy theme, just before we wrap up, it appears to me that there's a misconception among people that you need to go to a psychologist, and that's referenced in popular culture and everyday discussions that if you're seeking help, it's a psychologist, and that the fact is most people, as it seems you're speaking to, could just see a counselor, and what they're actually in need of is counseling, not psychology, which is a science and based in diagnosing and clinical, versus counseling. I think we tend to have the automatic reaction that if you need some help or you could benefit from talking to someone, that you need to go to your GP, get a mental health plan, and go see a psychologist, without considering that perhaps it would be right for you to go and find a counselor.
But coming on to that, yeah, look, people don't need to see a psychologist. They can see a counselor. A counselor is far better off in the sense that when you look statistically and you look at the statistics from from the Department of Health and Medicare and all the rest of it, the large proportion of Australians, over 80% who go and see a mental health specialist do not have a clinical condition. That speaks for itself. Counsellors are trained to work with people who don't have clinical conditions. Some have other training that they can work with clinical. Yes, absolutely. But primarily, unless they're training. And so the majority of people don't need to see a psychologist, but a good counsellor will always be able to. But the majority of
Mm.
Australians with the mental health challenges that they have, counselling is totally appropriate as a first option. And if you need more, a good counsellor will ensure that they refer you on.
Yeah, very well explained. And I suppose the point is that they all have their place, but it's important for people to know that, like you said, 70-80% of people could benefit from going and seeing a counsellor, because I don't think we think of it in that way.